One of the most common problems I see is abnormal uterine bleeding. This affects women of all ages, young women, middle, older women, and there are some very important ways to address this problem. First, diagnosis, and hormones very often cause abnormal uterine bleeding, and it's important to look at the hormone levels. It's also important to understand what is normal and what is not, and don't just go off by what the lab sends you as far as a result. Fibroids are something else that can cause abnormal uterine bleeding, although most fibroids don't cause bleeding. And as a specialist in fibroids, I find that's a problem all the time. If someone has fibroids, that always gets blamed for their bleeding when it's usually not the fibroid, and they get signed up for a hysterectomy. You want to try and avoid that kind of situation, and so you do want to see someone that does specialize in fibroids, like myself. Adenomyosis is another cause. Not very much is known about that by most practitioners, and adenomyosis is something that I do specialize in. Another area that very often causes abnormal bleeding is the area of endometrial polyps. Those are small growths inside the uterus that can cause bleeding type problems. These are very easy to take care of. They're usually not associated with cancer. The surgery is simple. You do not need a hysterectomy for this. And it is an area that I do specialize in. I'll often take care of those kinds of problems either in my office or as an outpatient. Testing for all these different diagnoses of abnormal bleeding problems is very straightforward. I do most all that testing in my office. It's very specialized testing, and you don't need to go out to other facilities. Insurance is usually covered by our office. Makes sure that it's covered, so you don't need to worry about that. My office is very good about looking at the expenses, looking at your insurance, and working with the insurance company and you to make sure things are covered.